Hey, it's Marzi. I want to just quickly try to give you an update as succinctly as I can, being as out of it as I am. But I may bang on. If I do, can you please just stick with me? It's key that I express this, but I understand it sometimes gets monotonous. So I'm going to do my best to be clear. My second request is please understand that in disclosing this, I am not wanting for you to feel more concerned about my situation and that I might be in danger, because I know my body after 18, nearly 19 years of being sick. I know my body well enough to know if it's crunch time and I have to go to the hospital, which most of you should know is incredibly dangerous and not viable for me because I don't have private health cover. And even then, anyway, I digress. So, I have whooping cough. We suspect I have really acute asthma when I get any sort of chest infection, and I have had since I was a child, asthma. So, we suspect I had another chest infection. My feeling was it was viral pneumonia, as I've had it before and I nearly died of it in hospital. So I know what that feels like. And it was a similar experience. And the reason we think there was some other sort of issue is with whooping cough, you have bouts of coughing, then you stop, have a break for a couple of hours or an hour, and then it happens again. You don't just cough and cough and cough and cough and cough normally. Maybe for me that might be how it presents. It might just be like that's what happens to me, but I don't think that's accurate, because whatever was causing me to cough constantly has now eased, and I'm now just having normal whooping cough, except it escalates very quickly from a couple of coughs to not breathing. I'm sorry for saying a lot. I'm so tired. So I also have gastro, which is causing severe dehydration, and my tongue is swelling constantly. I'm biting on it, so I have canker sores all over my tongue. It's excruciating, and I have fevers and chills, which, is something probably normal for other people that get really sick, but it's not something I usually experience. But I'm so inflamed, there's so much inflammation in my body, it's just trying to do whatever it can to get rid of it. So I'm getting heat stroke every time I stand up, nearly. It's crazy. The aircon's on 20 degrees and I'm getting heat stroke for standing up for 1 minute and get tachycardic, and my heart rate goes from 60 to like 120. So it's not good. I've also put on a ridiculous amount of weight. I don't know how much of it is my lymph nodes, how much of it is fluid, and how much of it is weight. I'm not eating well, but I'm also not eating that much because I'm sleeping a lot. My lymph nodes are insane. My chin actually comes, I don't know what you call this. In my chin, I guess. Just feels like my chin's there. But anyway, it comes, I guess you gullet if you're talking about a fish. It comes down to here when I'm like got my head properly forward. And my face is huge, so if I turn to the side, you can see how sharp my cheekbones are. And this actually, I've got a big crease there and a big crease there because my cheeks are encroaching on my eyes. It's hard to see in this light, but yeah, it's something that's kind of really painful. I have that massive cyst here that sits behind both of my eyes, so it's at least that wide. And it's incredibly painful. So I'm having intense migraines daily. I also unfortunately believe that I am going to have my time of the month, which may be TMI, and the reason I mention it is because I have low blood volume, and I also have really severe issues with oxygenating my brain. So my grey matter has decreased due to severe oxygen deprivation, because the combination of factors of low blood volume, one of my infections feeds off blood cells. I'm probably going to say things wrong, just roll with me. And the cysts that I have in my sinuses prevent oxygen uptake. This side's totally blocked. So I am now experiencing the worst joint pain I've ever experienced, and that may only be because I've already reached well past my limit in terms of what I can cope with, but I am coping. I will say to you that a lot of the reason I am coping is due to your messages, your post, your donations, your love, your thoughts, your prayers, your healing modalities that you send me, everything that any of you have done for me, facilitating me accessing supplements that I need, that sort of stuff. Just it means so much, and it's how I'm keeping sane, so thank you. I need to ask of you whether you are able to support me, because I need to be able to manage this, and in order to manage this I need to be able to quickly step in and use the knowledge gleaned over the long period of illness that I've had and doctors, advice to prevent symptoms from escalating. And I'm starting to run out of money to do that, and it'll be back to food or whether I buy meds. So if you can give, I would greatly appreciate it. I'm sorry that this went on again, or you're not going to see the other videos. Sorry, I'm so out of it. Okay, I'll go. Thank you for listening. Thank you for bearing witness. Oh, just the other thing, my neuro symptoms are all off the charts. So having seizures, dystonia, tics, Tourette's, the whole gamut of neuro symptoms happen on top of being in so much pain from coughing all the time. Is just, it's cruel. But anyway, like I said, I keep on trucking, and I will be, oh God, I'm so dehydrated. I will be okay. So, love you. Thanks for bearing witness. Thanks for being you. Love, light, blessings, and gratitude. Marzi.